Now, oral cancer is a surprisingly serious and growing problem here in the U.S., and the key to fighting it successfully is early detection. Joining me now are Dr. Stacy Layman and Dr. Freydberg from Arizona Studio for Smile Design. It's good to see you both.
How
Thanks
are you
for being
doing
here.
today?
I'm doing well, but we were talking earlier, too, about this whole oral cancer. You think, oh, in today's times, probably doesn't happen anymore. We're so on the cutting edge, but you said you are seeing it.
Well, I actually wrote down some statistics so I can give them pretty accurately. But we're finding, not in our office obviously, but there are about 37,000 new cases a year detected.
Ooh. It's actually growing.
Yeah.
Wow.
Unlike other cancers that are decreasing.
Right.
Is it because people aren't catching it, or?
Well, yeah, catching it early is the big thing, or catching it before it becomes tissue that will become cancerous is the big issue. The other thing that it's growing in is 25% of people who get oral cancer now are not the high-risk people of the old days. Alcoholics, smokers, chewing tobacco.
Sure. That's what I would think of.
Yeah, but 25% are not those. Mm-hmm. And that's a new surprise. There's an 80% survival with early detection. 100% survival if you detect the tissue that could become cancerous before it does. And 22% survival by the time most of us catch it with the naked eye. That's
22%.
Yeah, that's pretty.
By the time, like me looking in the mirror,
or
goes,
even a
that?
dentist just looking in the mouth. By the time
that's
with
not
the
good
naked
enough.
eye, that's 22%.
22%.
So how do you catch it? I would think when you get your teeth cleaned, is that a bad assumption? I think they're checking. That's not good enough
Oh, no.
to just look,
That's
right?
what we've always done is we've just looked in the mouth, and if you find it at that point, 22%. It's just beyond the point where it can. It's just very big and bad at that point.
So what can you do to look for it?
Well, that's what we brought in is what's called a Velscope. And when the last time I was on the show, we talked about that I used to lecture on technology. So I've been using the Velscope as a technology tool for years. The research came out of British Columbia, actually. And what this device allows you to do is, I guess the best way to say it is to look under the tissue. Because before tissue changes to the naked eye, it's too late.
Okay.
So I can take this light, and it enables me to look under the tissue and see if there are changes underneath. And it just looks like a shadow to us.
I see. We have some pictures, I think, too, that kind of give you an idea of what you're seeing maybe with this thing. So here's what you'd see, I guess, with the naked eye, obviously. And then
on the left, yeah.
On the left, yes.
So normal tissue is green. Abnormal tissue is going to be a dark area.
I see.
Under the light.
So I see it
So
right there on the right side.
this next one, this is perfect. Look at that. You wouldn't even see anything.
Right.
But if you look at the right picture, the dark area, that is actually cancer.
Wow, because when you look at the other one,
You
it
wouldn't
looks
see it.
healthy tissue, like pink healthy tissue.
And the other great thing about the light is it'll show you tissue that is pre-malignant. So, you know, some cancers, like the reason for reduction of cancers, like colon cancer, is it takes so long for certain tissues to become malignant. So they can be detected early. This device comes from lung cancer detection. It's not like something was created for just oral, but it was adapted.
And I'm assuming it's a quick little scan around,
quick,
right?
Sure.
And is it part of your treatments?
Every patient gets it.
Everybody gets it.
And I want to say something. This is really important. The reason that oral cancer is growing rather than decreasing is because they have linked it to the HPV virus, the human papilloma virus, which is also, they've linked it to cervical cancer. This is becoming a very big problem in younger women because of oral sex. That it's a sexually transmitted disease, and younger women are getting throat and oral cancer.
It's a new population.
It's really bad stuff. So anyone that's sexually active needs to have this test. Period. That's it.
So, and is it part of like a dental cleaning, or is it an additional thing? Is it expensive to get it done?
Anytime anyone comes in, they get this, period. And right now, we're not charging for it. As a matter of fact, on Wednesday morning, Dr. Freydberg Wednesday morning, and then all day Thursday you can come in and have a free screening.
Wow.
And you can call and make an appointment, or you can just show up. We just want people to come and do it. You can also get the Lumi Smile.
Yeah, I know you always have great specials, you know, every now and then you call in, find out what's going on. So besides getting, you know, checked, which is very important, you can also get a nicer looking smile too. And you have a special on that right now too?
The Lumineers, again, you know, it's the thin shell of porcelain, and it goes right over the top of the teeth. It can change the color and the shape of your teeth permanently. We're doing $1,000 off 4 or more units. That's going to last for about 30 days. And then the last one is Invisalign Teen for the younger kids. Instead of having to have the braces, you can have the clear braces. And we're doing $500 off of that for the next 30 days.
And your teens have to be diligent about keeping them on. That's the key.
They have to convince me that they're going to do it.
Right. Yeah.
And, you know, I forgot last time I was here. You want to see Lumineers? How dumb am I?
Smile right into Bob's camera, Dr. Freydberg. Smile.
And I had a where
you got to give Bob a big smile there, Dr. Freydberg. Stop talking, smile. There you go.
That's going to be tough.
So I had, my smile was worn. I had a bicycle accident, fractured. I wasn't going to have them ground down, so I just had them covered with porcelain.
Yeah, and they look.
And the women, the beautiful women like you guys, always go for lighter shades than men like me, but that's up to the patient.
You can pick.
You pick, and it's up to the patient.
Thank you, as we're all smiling now. Thanks, Dr. Layman. Thanks, Dr. Freydberg.
Good to be
Very
here
good
again.
information to know, and it's so sad to see that numbers are increasing in today's time.
Tough.
So please get it checked if you have any doubt whatsoever, and it's good to see you both.
Thank you.
And if you do want more information about Arizona Studio for Smile Design, of course, you can visit them on the web at azsmilestudio.com, and there's the phone number right there on your screen. And don't forget about the specials we mentioned earlier, too, so check it out.